Hello, welcome to Painnavigator Yoga. Today we are going to be doing some exercises on the floor. I want you to lay on your back as we begin. You can do these poses any time of the day, but it's preferable to do it on an empty stomach or after a light snack, not a big dinner. Let's begin. I want you to lay completely still, just like this. Believe it or not, this is a yoga pose, and it's actually the hardest yoga pose. It's called Shavasana or corpse pose. You have to be completely still, and that's very hard for us. So just breathe here, and we're going to begin. You're going to inhale and bring the right knee in. Bring your hands over and try to bring the knee to your armpit. So you're going to bring the right knee out to avoid the right rib cage. And then as you exhale, you're going to really bring that knee in to the armpit. Bringing your arms here. Use your arm strength to pull the leg in, just like this. Wonderful. You want to feel the opening in the hip. Wonderful, just like this. So doing a pose like this actually helps you to open your hips and do a stronger warrior pose or a lateral stretch. These are all poses that are in earlier modules. Everything is still connected. Your entire yoga practice is connected. Wonderful. Inhale, release. Now we're going to do the left side. Inhale, bring the left knee in. Bring your hands over. Try to interlace the fingers. This right here might already be a big stretch for you, and that's totally fine. Hold it here and always trying to bring the knee out and down. Out and down. Out and down. Good. Now for the leg that's stretched out, you want to keep it on the floor. You don't want to do any of this. So that might mean that you don't come down as far, just like this. It's important to keep the hips down and just come down slowly. Wonderful. Good. Hold it here. Inhale, release. Great. Now we're going to do both legs. You're going to inhale, bring both legs into your chest. Good. Right here, you should already feel a stretch. I really want you to work on keeping the tailbone down. Don't bring it up. Just try to keep it down as much as you can. Now, I know that might seem impossible or very difficult right now, but just keep that image in your mind, trying to keep the spine nice and straight. You're going to come over the legs and try to bring your hands to your elbows. Now, that might seem very difficult today, and that's okay. You can slowly either bring hands to hands, fingers interlaced to have a strong grip, or hands to wrist, hands to forearms, and eventually hands to elbows. No matter where you are today, bring those knees into your body. Wonderful. And I really want you to keep your chin tucked, just like this. Giving yourself a triple chin here so that you don't have a double chin in your everyday life. Good. Really trying to keep the entire spine straight on the floor, bringing those knees in. Really give yourself a nice big hug. Hold it here, breathing, breathing, breathing. Use your arm strength and release. Inhale, release. Oh, such a wonderful stretch. In corpse pose here, you want to take in all the benefits of the pose. Let's do that again. Bring the right knee into the body. Arms over. Inhale. Exhale, bring the knee out. Inhale, squeeze. Exhale, bringing the knee out. Exhale, squeeze. Bringing the knee as close to the armpit as you can, keeping both hips onto the floor, and keeping the leg nice and straight. This might be difficult, so I just want you to take it step by step. That might mean that your knee is going to be here today, but just keep trying to imagine bringing the knee close to the armpit and using your arm strength. Very good. Opening up the hip. Inhale, release. We'll do the other side. Inhale, left knee in. Bring the hands over. And let's take it step by step. Here, if this feels like a big squeeze, this is your pose. You don't have to go any further. Remember, you want to keep both hips in one line, leg rest on the floor. Inhale, come out, exhale, squeeze. Inhale, come out, exhale, squeeze. Inhale, come out, exhale, squeeze. Very good. Use your arm strength to get your knee as close as you can to your armpit. Nice. Hold it here. Breathe in. And exhale. Release. Now we're going to do both legs at the same time. Inhale, legs up. Bring your arms over. Bring your arms over. Remember, you can do palm to palm, hands to wrist, hands to forearm, or hands to elbow. Whatever feels best for you. Tuck your chin in, keeping the entire spine straight on the floor. Good, melting into the floor. And then you want to give yourself a big hug. Use your arm strength here. Keep your shoulders down. You don't want to do this. You want to keep the shoulders down on the floor. Everything as close to the floor as possible. Your hips are down, entire spine down, chin down, shoulders on the floor. Good, nice squeeze. Inhale, release. Wonderful, back in Shavasana, you're getting all the benefits of this pose. Now we're going to do some more hip stretching. You're going to bend your left knee, bring your right foot over, just like this. Right here, you should already feel the stretch in your hip. You're going to inhale and push the right leg away. Good. Don't put any pressure on the knee, just on the leg. Push slowly, gently. Feel the opening in the hip. Wonderful. Both hips are on the floor. Good. Inhale, release. Switch sides. Bending the right knee onto the left side. Bringing the left hand onto the left leg and push. Good. If you feel like your right hip is coming off the floor, use your right hand to keep your right hip down. Breathe here. Inhale, exhale. Inhale, exhale. Good. Inhale, release, and come down to corpse pose. Complete relaxation.
Are you ready for Painnavigator?
Finally, an app that helps me manage my lower back pain around my busy schedule and not my doctor's.
This app has really been useful as an aid in my pain therapy.
I have chronic low back pain.
I have chronic back pain.
Painnavigator is an easy-to-use chronic pain app that integrates first-line modalities into a program that you can complete virtually anywhere. For less than 30 minutes a day, you can get a better handle of your chronic pain and start enjoying your life again. Painnavigator is the only chronic pain app that offers first-line evidence-based therapy in a progressive, customized program that will help you maximize your pain control.
The back is complicated. This app is informative and it's giving me tools to help reduce my chronic pain.
I was really skeptical about an app being able to help me with my chronic pain, but now I'm back on track with healthy coping.
Isn't it time you took a more active role in your pain management instead of just relying on your doctor, medications, and procedures? Are you ready for Painnavigator? For more videos like these, sign up at painnavigator.io. Use program code WELCOME21.